To set the stage for tonight's discussion, I want to discuss one potential healthcare proposal which has attracted a lot of support, and that is a proposal that would raise your taxes, swell the federal deficit, and leave more Americans without insurance. This plan, call it Plan A, will grow the cost of health care 3 times your average wages and will double, triple, and even quadruple your premiums over the next decade. Plan A will continue to increase out-of-pocket costs for people with insurance by an average of 32% over the next few years. This same plan will direct that 1 out of every $5 spent in this country will be spent on health care, and it will wrestle 1/3 of the country's economic output and tie it up in the healthcare system. This plan that we're calling Plan A will increase costs that will devastate families and businesses, keep wages flat, stunt our economic growth, allow insurers to drop you if you become too expensive or too sick, allow them to refuse to cover you if you have a pre-existing condition, charge you more if you're a woman, and put no limit on your out-of-pocket costs every year. This plan, Plan A, as many of you have guessed, is the status quo. This plan does not sound like a good plan to me. And that is a plan for those of us who are already insured. Plan A also leaves approximately 50 million citizens in the United States uninsured, and approximately the same number who are underinsured, and offers them little hope of accessing quality care anytime soon. So the starting point, in my view, is a plan that leaves millions of Americans with a difficult choice of whether to pay their medical bills or pay their mortgage because they can't afford to do both, and that forces many others into bankruptcy or foreclosure. 2/3 of all bankruptcy and half of all foreclosures are the result of a healthcare crisis in the family. As a nation, we spend almost twice as much per person on health care as any other country, or about 16% of our GDP. We're paying $6,000 more per individual on health care than any other industrialized nation. And for all the money and some of the best providers in the world, our health care system does not produce the best outcomes. According to the WHO, the United States ranks 37th in terms of healthcare performance, and is far behind many other countries in indices like infant mortality, life expectancy, and preventable death. As we speak, committee chairs and our leadership are working to resolve differences in 3 bills that are before the Congress. And I would like to encourage you to share your thoughts, your input, and suggestions. None of us are omniscient. I certainly am not. And we would welcome your feedback on what you like and what you don't like about the current proposals. The Senate has moved at a slower pace. A bipartisan group of 6 senators in the Senate Finance Committee have been meeting daily for weeks to produce a bill in the Senate. But there's some provisions that we know in both the Senate and House bills are likely to make the final version. And they are bills that would prohibit the rejection of coverage based on pre-existing conditions. They would eliminate charges for preventive care, eliminate lifetime caps on coverage. These are provisions that are essential for maintaining stability and access to quality and affordable care. Both versions would also establish an exchange for consumers where they'd be able to compare plans side by side and purchase affordable coverage. One of these options would be a government-run public option. will like this and half of you won't, but I believe that a public health insurance option will provide greater choice to families. Well, it's important also to provide competition with private insurers. And act as an incentive for them to lower administrative spending and use more healthcare dollars to provide actual healthcare. I've been working on two fiscal concerns I have with healthcare reform. How to reduce healthcare costs for those who have coverage already, and how to ensure we don't swell our deficit and national debt. We've taken important strides, but there is more that we can and must do.